for your clients and colleagues. You'll have a sense of how to create a welcoming and supportive environment, and we'll give you some tools so that you'll feel comfortable showing folks how to use the Q card. And then my ultimate hope is that you will feel empowered to educate other people about how to create safe and welcoming spaces for LGBTQ people. Next slide. All right, so a little bit about me and why I do this work. I'm 33 years old now. I came out when I was about 16, so I've now been out for more than half my life. I'm also an extrovert and a people person. And so I've met a lot of LGBTQ people in my life, and I've never met one who hasn't had a negative experience in healthcare or in social services. And those things exist on a spectrum. They range from sort of people making inappropriate or judgmental comments, all the way up through experiencing assault in a healthcare setting. And I think we can agree that this is unacceptable. We just don't have a lot of tools for addressing it. So even though over the past 10 or so years, there's been a lot of data, a lot of research under the Obama administration. A number of federal offices released reports on health disparities in LGBTQ communities and what clinicians can do. There wasn't a whole lot about what patients and communities can do. And so I started working on Q Card Project when I was a graduate student in public health at the University of Washington. And so I've been doing this work now specifically for about 7 or 8 years. And I love working within these communities, and I love talking to other people about the importance of this work. And I want to be clear that I identify as part of the LGBTQ plus community, and I recognize that there may be people on this call who also identify as LGBTQ plus. And so I don't like to talk about this community like we're this mysterious other, right? You probably go to church with LGBTQ people, you work with LGBTQ people, you might have LGBTQ people in your children's community or your partner or your spouse's community, right? We're everywhere. And so it's really important when we talk about this community to recognize that this isn't some outside group. We are probably part of your community, whether you know it or not. Next slide. So just to start us off, and I apologize if this is review for folks, but I think it's important we're all working from the same foundational understanding. So when we talk about the LGBTQ community, and to be clear, it's not one community, right? There are many LGBTQ plus communities. We don't all agree on everything, just like everybody else, every other community, right? There's a lot of diversity within LGBTQ communities. So when we say LGBTQ, we're talking about lesbian, gay, bisexual, transgender, and queer or questioning individuals. And questioning just means sort of exploring sexual or gender orientation. You might also see that acronym with the letter I for intersex, which is folks who have chromosomal combinations that are not exclusively XX or XY. You might also see an A for asexual, which is people who don't experience sexual attraction. And you might see a plus for other identities. And this acronym could go on and on and on because there's such diversity in our community and so many different ways that people identify. When we use the word transgender, we're talking about an umbrella term that includes people whose gender identity does not exclusively match the sex that they were assigned at birth. So when we're born, someone looks at our genitals and puts a pink or a blue hat on us. And for most people in the world, that identity matches, right? So I identify as a woman and I was assigned a girl at birth. And so I identify as cisgender, which is a person whose gender identity does match the sex they were assigned at birth. So people who are transgender don't feel like the sex they were assigned at birth matches what they know to be true about their own gender. When we use the word queer, and this is a word that a lot of people struggle with, and that's okay. When we use the word queer, it is both a unique identity within the LGBTQ community. It is also an umbrella term. So you might hear people talking about the queer community, or you might hear people say that they identify as queer. And if you're uncomfortable with that word, it's okay, right? There's a lot of discussion within communities about whether that word is okay or not, because historically it was a very violent word. And some people feel like they have reclaimed it, and some people feel like that's not okay. It's important to talk to people about what words they like to use for themselves. The next term here is sexual orientation. And it's important to recognize that sexual orientation is a combination of a person's sexual identity, behavior, and attraction. Now, for most people, those things will sort of fall in alignment. but not everyone. So it's important if you're talking to somebody, for example, if you're trying to counsel somebody on pregnancy prevention or their sexual risk taking, it's important for you to understand their behavior, because they might have an identity or attractions that don't line up with their behavior. So we can talk a little more about that if folks have questions. And then gender identity is a person's internal and rooted sense of their gender. Now, that might be in alignment with the sex they were assigned at birth, or it might not be, but it's important for you in providing services to know how that person identifies and how they'd like to be referred to, how they'd like to be addressed. Next slide. Okay, I love this slide because I think that often in sort of cultural conversations about sexual orientation and gender identity, we like to think that those things only apply to LGBTQ plus people. But the truth is, everybody has a sexual orientation and a gender identity. It's just that most people don't have to think about them, right? Because how they identify sort of lines up with societal expectations, and so they don't ever have to think about these things, right? It's a form of privilege that, oh, of course I'm heterosexual, so I don't ever have to think about these things. Whereas people who identify as members of the LGBTQ plus community have to constantly think about these different identities. And so I really like the Gender Unicorn, which was created by a fantastic group called Trans Student Educational Resources. They have fabulous resources on their website, from stickers and flyers and pamphlets and things. So if you're ever looking for resources for particularly transgender youth, it's a great resource. And this does a really good job of lining out the different pieces of this, right? So you can see with the unicorn in their thinking, that's their gender identity, right? What's happening in your brain, what's happening in your heart is your attraction, and that's physical attraction and or emotional attraction. And then you can see that sort of DNA strand in the unicorn sort of genital area. Which is your sex assigned at birth. And so realizing that we all exist on these different spectrums, and so even cisgender heterosexual people also have a gender identity and a gender expression, but they don't always think about them, right? So I identify as a woman, but I tend to dress in ways that look a little more masculine. I haven't worn a dress since I was like, I don't know, 21, and that was for someone's wedding. You're much more likely to see me in a suit and a bow tie, because that's my gender expression and that's where I'm most comfortable. But that doesn't mean I'm not a woman, right? So it's important for everyone to think through. And I encourage you all, whether you identify as a member of the LGBTQ community or not, I encourage you to think for yourself about your gender identity, your gender expression, your sex assigned at birth, and your attraction, and sort of map those things out for yourself and see where do you fit along some of these spectrums. I find that it's a really helpful exercise, especially in building empathy. Next slide. So underlying all of this work for me is the fact that in the face of all of this historical stigma and oppression, LGBTQ people are incredible, right? We are brave, we are strong, we are healthy, we are leading our communities, we are leading change. And we don't often get a lot of credit for that, right? We mostly talk about things that are wrong with our community instead of talking about what's great about our community. And I want to dig into that a little bit on the next couple slides. So some of the disparities that we see in LGBTQ youth specifically, we see stigma, we see bullying, we see a lot of violence, interpersonal violence. Sometimes that comes from inside the family, sometimes it comes from classmates, sometimes it comes from community members. We see a lot of mental health struggles, particularly depression, anxiety, suicidal ideation. And I want to point out that all of these things are amplified for transgender and gender nonconforming young people. We see higher rates of substance use, we see housing instability, often as a result of family rejection, and we see an overall lack of social support. And these things are true across the country. I think that there's an assumption that in a big city like Seattle or San Francisco, these things don't happen as much, but the truth is they happen everywhere. And all of these things are the result of some of that cultural stigma and cultural homophobia that we internalize as LGBTQ people. So even LGBTQ kids in supportive families might experience some of these things, because even though they might have a family that kind of buffers them from some of that, they're still getting societal messages. So it's important to recognize that we all have a role to play in supporting young people and making sure that they feel seen and loved. And recent research is showing that even one supportive adult in the life of an LGBTQ young person. Doesn't have to be a parent. It can be a counselor, a nurse, a social worker, someone from their church community, or just any supportive adult can make a huge difference in their mental health. So don't ever think you don't have a role to play here because you're not, you know, well, my kid isn't LGBTQ, right? We all have a role to play in supporting these young people. Next slide. And it's important to recognize that these disparities persist over time. So those disparities we see in LGBTQ young people turn into chronic diseases in LGBTQ adults. And some of that is because of that internalized stress, if people are familiar with the minority stress theory. But some of it is also that those things manifest, the constant pain, the constant struggle manifests in our bodies. And that's true of a lot of minority communities. And so LGBTQ adults have higher rates of obesity, mental health conditions, heart disease, HIV and sexually transmitted infections, higher rates of substance use, tobacco use, alcohol use, and higher rates of some cancers. And some of this is because for a long time, LGBTQ people have had trouble feeling safe and welcome in healthcare spaces. And so they're more likely to forego treatment or getting that annoying bump checked out. And then by the time they do get it checked out, it's a much more advanced cancer than if it had been caught early. But because of fear of engaging with healthcare and concerns about experiencing discrimination or harassment, a lot of LGBTQ people don't seek the care they need when they need it. Next slide. So I want to make a quick note here about intersectionality. And some of you may have heard this term before. It was coined by a Black woman academic named Kimberly Crenshaw. And it specifically looked at the ways that Black women had trouble making cases for sexual harassment or discrimination in workplaces because all of the legal precedent focused on Black men and white women. There was no legal precedent for Black women for seeking redress for discrimination. And so it was about the ways that intersecting systems of oppression can make it even harder for people that experience multiple marginalized identities. And so as an example, an LGBTQ person of color might experience racism and homophobia. And beyond that, they might experience racism from within the LGBTQ plus community. And that's a really important thing to recognize. Like I said earlier, we are not a monolithic community. And the LGBTQ plus community has a racism problem just like every other community. We haven't perfected that, right? And so an LGBTQ person of color is having a fundamentally different experience than an LGBTQ plus white person, because I don't have to experience racism, right? And a person who's LGBTQ and who's living with a disability might experience ableism in addition to experiencing homophobia. And that person might have trouble accessing certain LGBTQ events or spaces if they're not ADA accessible. So in thinking about these things, it's really important to understand that all of us have different identities, right? We are all more than one thing. And when you're working with clients who are LGBTQ, it's never safe to assume that all LGBTQ people are having the same experience. We all have multiple identities, and some of us experience multiple kinds of discrimination and oppression because of those identities. So I feel like that's an important thing to think about in working with clients. I think people tend to assume like, oh, well, I have a gay friend, so I know how to talk to all gay people, but that's just not true. We're all different, just like everybody is different, right? We all have those different identities, and we want to be able to bring our full selves into whatever space we enter. Next slide. Okay, so on the whole, what do LGBTQ clients want? Research shows us over and over and over again that we want the same thing everybody else wants. We want professionalism, we want respect, we want cleanliness and confidentiality, right? We don't need specialized, specific care. We want what everybody else wants. We want to be treated with decency and respect in a clean and professional environment. And I think that this is important because there's an assumption among a lot of folks in social services and healthcare that you have to be LGBTQ in order to provide excellent care to LGBTQ people. And that's just not true. And in fact, there aren't enough LGBTQ people in these professional spaces for that to be a reasonable demand or a reasonable expectation. And so we need allies. We need people who are not LGBTQ plus, but who are willing to listen and who are willing to provide us with excellent care. Next slide. So what can you do? What does this actually look like? At the start, give everyone who comes in your door a warm welcome. Make them feel seen, make them feel appreciated, and like you're here to provide them the best care you can. Think about asking people their name and pronoun, right? It's not safe to assume that by looking at somebody, you can tell how they want to be, how they want to be referred to. Think about your intake forms, whether they're on paper or whether they're electronic. Is there a space for a person to indicate their pronoun, or if they don't go by their legal name, and that is also, this is a great example of one of those ways that this isn't just about transgender people. This is about everyone, right? If I go by my middle name, right, and that's the name I prefer to be called, having an intake form that lets me tell you if I want to go by a different name also helps that person. It's not just for trans people. So thinking about your intake forms and do you need to update them? And then this is one of the pieces I always get questions about, which is what to do if you make a mistake. And we all do this, right? We all slip up, we all get someone's pronoun wrong, or we accidentally call them by the wrong name. And the best thing that you can do is apologize and move on. Because what happens way too often is you make it about yourself and how sorry and how uncomfortable and how terrible you feel. And then the patient or the client is in a position of saying, it's okay, and it's never the job of the patient or the client to take care of you when you make a mistake. And so I found that one of the most helpful ways to think about this is something called ring theory, which is the idea that when something bad happens to a person, if you're not the person who is in the middle of that circle who has been hurt, you only offer comfort towards the person who is more aggrieved or more hurt than you are, and you process your own feelings about it with someone who is further away from that harm. And in this example, what that means is if you accidentally use the wrong pronouns for someone, you just say, I am so sorry. I know that you use he, him pronouns, and I'm going to do better. And then later in the break room, you can process it with one of your colleagues and say, I felt so terrible. I totally messed up this client's pronouns. I've been working on this. I just felt so terrible. But you don't have that conversation with the client. You just apologize and move on. And you have to get yourself to a place of self-reflection where you can realize that if that patient is upset with you and doesn't want to see you again, that's okay. And you did the best you could, and you're going to keep trying to do better. But the client or the patient gets to decide if they want to come back and see you again. And you can't take that personally. You have to do the best you can every time with every client. And the truth is that trying makes a huge difference, because you have to realize that there are a whole lot of people in the world who don't even want to try. So just by trying to use the correct pronouns and by apologizing, that can make a difference for someone. So give yourself a break, give yourself some credit, and just try. Just try. So next slide. So some other things you can do. Always talk about privacy and confidentiality, especially with youth, people who are under 18. Research shows us that LGBTQ young people are much less likely to come out if they don't know that the conversation is private and confidential. And as part of that, be sure that the person you're talking to understands the limits of that confidentiality, right? So if they disclose that they're going to hurt themselves or hurt someone else, you may have to break that confidentiality. But if you don't mention it at all, a lot of LGBTQ young people won't tell you that information. So making sure you're creating a space where they know they can talk about those things. And then a huge piece here is avoiding assumptions, stereotypes, and generalizations. Don't assume that everyone who appears in your office is cisgender and heterosexual, because those kinds of assumptions are what make people feel like it's not safe to tell you that there's something else. People might tell you things that shock you, and that's okay, but practice saying, I'm so glad you told me that. So if the person sitting in front of you is a 17-year-old and they tell you that they're gay and that they've had 6 sexual partners in the last month, instead of you immediately spitting out and going, oh my God, that's so unsafe, are you using condoms? Step back and say, I'm so glad you told me that. Because if this person trusts you enough with that information to tell you, you have to honor that that was a risk this person was taking, right? And you have to take that seriously, that they've trusted you. And you say, I'm so glad you told me that. Is there any information you need? Do you have any questions that I can help answer, right? If you immediately go to a place of judgment about what they should be doing differently, that person's going to be much less likely to be honest with you in the future. If you're in a physical space where you have people come in for visits, think about posting affirming and welcoming signs, something like, all are welcome here, or if you feel comfortable and if you feel like you're in a place where you can actually live up to it, you can put like a rainbow flag on your door or something. But I will say it's really important that if you put that flag on the door, everybody inside is prepared to respond to the needs of LGBTQ people, because we often feel betrayed if there's a flag on the door and then we go in and we get bad treatment. It feels like you lied to us. Like you made me feel safe here, but then you didn't live up to it. So don't just slap a rainbow flag on the door. Make sure that you're prepared to really show up for LGBTQ people. And then always validate people's experiences and identities, right? It's never the job of an adult or a professional in these spaces to interrogate why a person thinks that they're gay, or how do you know you're transgender, right? That's not our job. Our job is to provide support services to the best that we can. And so always validating people, right? And saying, I'm so glad you told me that, you're not alone in this. There are a lot of people out there like you. And, what kinds of support do you need? And then this piece I love to talk about with professionals in social services is about making informed referrals. And don't be afraid to call ahead, right? I used to work for an organization that we provided support and case management to young people experiencing homelessness or housing instability in Seattle. And often they would need to go, for example, for an eye exam. And I would call ahead and say, hi, I'm making a referral for a young person. Is there anyone in your office who has experience working with transgender young people? Because I want to make sure that I'm sending a person to a safe space. Or if you can, accompanying a young person to an appointment often goes a long way. But just calling ahead and saying, do you have a gender neutral restroom on site? Does your intake form allow people to write in their pronouns? Trying to do a little bit of that screening ahead so that when you do send that young person to the referral, or any client of any age, you can feel confident, or you can tell them honestly, look, I called ahead. I'm not confident that this place has a lot of experience working with LGBTQ people. I want you to be prepared to advocate for yourself a little bit, and here are some tools to help you do that. Next slide. And then here, some things to avoid doing. And I think that these pieces are really, really important, because I can't give you the golden key and say, this is the thing to say every single time. Because like with any community, all of us are different. And what works really well for me might not work well for other people. But this is I think based on what I've learned and what I've heard from my community, I think that this is a list of things that tend to never go well, which is, don't ever make us educate or take care of you. And that goes back to what we were talking about with ring theory and when you make a mistake. Just apologize and move on. I don't want to have to tell you it's okay, right? I want to be able to just come in for what I came in for. Don't ever ask LGBTQ people about their genitals. There are very few situations in which this is relevant and pertinent. And if it's just from your curiosity, that's not a good enough reason to ask the question. So for example, if you're talking to somebody about their pregnancy risk, asking them whether they have a uterus and a vagina might be relevant and important. But if you're screening someone for a housing intake, that might not be as relevant. So be thoughtful about whether it's actually necessary you ask those questions. Don't ever make assumptions about identity, behavior, or attraction. And instead of asking questions, if someone's sitting in front of you, you have decided this person looks to be a woman, don't ask a question like, do you have a boyfriend, right? Instead ask, do you have a partner, or do you have multiple partners, right? Because you don't want to assume the gender of their partners. Sometimes those questions with assumptions built in are called microaggressions. And over time, any LGBTQ person in the world will tell you that they've experienced a range of microaggressions, as have most people. So thinking about how to avoid doing those things. Don't ever use derogatory terms to describe LGBTQ people. You are allowed to have your personal opinions, but they should have no bearing on the care and the services that you provide. When you show up at work, you are there to treat everybody with respect. So don't ever use those just derogatory terms. And I will say that there are some people who might come in and talk to you about their identities, and they might identify in ways that you find uncomfortable or hard, and that's okay, right? So if the word queer really makes you uncomfortable and you're talking to someone who identifies as queer, Try your best to use the language that the patient or the client is using to describe themselves. And then again, if you need to process your discomfort later, you can do that with another colleague or someone else that's not the client or the patient. And then don't assume that LGBTQ people require specialized care or expertise, right? For so many of us, that just becomes an additional barrier, right? Trying to find the person who is really well trained and who's totally competent and the most LGBTQ sensitive, often that is like one person and everybody is trying to go see that person, and it just creates additional barriers. And when I do this talk with clinicians, I talk a lot about this because for folks who are underinsured or uninsured, it can be really hard to find that one like unicorn LGBTQ identified endocrinologist that you need to go see. So don't assume that we need to go see those specialized people. In fact, anyone can take excellent care of an LGBTQ person. You just have to try, right? And if you work in social services, you're there because you care, right? You want to help, you want to be of service. And that means you already have the skills you need. You know how to listen, you know how to be kind, you know how to reserve judgment. And those are the key pieces for taking excellent care of and creating safe and welcoming spaces for LGBTQ people. Next slide. All right, let's talk a little bit about allyship at the office. And I always, you may have heard the phrase charity starts at home. If you don't have a workplace that's welcoming for LGBTQ employees, why would clients ever feel safe in that space, right? And so if you haven't created a culture within your colleague team that welcomes and respects and affirms LGBTQ identities, it's going to be a lot harder to create that environment for your clients. So how do we do this? We start by not assuming that all of our colleagues are heterosexual and cisgender, right? So asking people if they have a partner instead of asking people if they have a boyfriend, right? Thinking about higher level sort of HR policies, does your office have a non-discrimination policy? And is it LGBTQ inclusive? And should you consider posting it publicly somewhere? Because that also sends a strong message to your patients. If you have a front desk, can you post something at the front desk that says our office believes in treating all people regardless of, and then having a list that includes sexual orientation and gender identity, right? And often we have state and county-wide protections, but those things can look a little different from workplace to workplace. So thinking about whether you might need to update that policy and whether you might want to post it publicly, which sends a really strong message to employees and to clients. A lot of folks are now adding their pronouns to their email signature, and it's really important that it's not just transgender and gender nonconforming people who do that. It's important that everybody does that. And I'm a person I've been doing that for years, partly because my name, Jenya, is not recognizable to most people as sort of a gendered name, right? There are a lot of names that people read and they assume that they know the gender of that person. My name isn't one of those. So for years, I've had she, her in my email signature so that when people email me, they have a sense that, they know, like, I identify as a woman, I use she, her pronouns so that they can address me in a more appropriate way. And so again, whether you're cisgender, transgender, gender nonconforming, we can all show up for our colleagues by just putting our email signature with our pronoun. It doesn't take a lot, right? And if you can get even a simple majority of people in your office to do that, it really sends a strong message. Think about the bathroom situation at work. Do you just have two restrooms that are male, female, women's, men's restrooms that are totally separate? Or do you have any single-use restrooms? And then thinking about things like, do you have menstrual products in your restrooms? And are they only in the women's restroom? Well, you may have a transgender colleague who can't access those things because they're only in the women's restroom and he uses the men's restroom. Or even things like, is there a safe place for people to pump, right? If they're chest feeding, if they're nursing. Making sure that people feel comfortable using the restrooms that you have. And that can be one of those things that if you don't have any gender-free or gender-neutral restrooms, that can be a hard thing to change. But I think if you don't have a restroom situation that feels like everybody can use a bathroom that feels safe for them, it's certainly an important thing to bring up, even if it may take a while to get that changed. Because that's like a construction, you gotta like knock down walls and build new bathrooms. And that can be hard and it can take a while, but it's important to bring the conversation up. Really important to never out a colleague, ever. Especially if that person is not publicly out, right? I'm out to everybody I work with. And most people who meet me make assumptions about my identity. And like, I've got rainbow flags and pictures of my partner at work, but not everyone is like me. And so if a person tells you that they're LGBTQ, don't ever assume it's okay to talk about that unless they tell you, or you can ask, right? You can say, I'm so glad you told me that. Have you talked to anyone else at the office about this? Would you like me to keep this confidential, right? Because again, if people are trusting you with that information, you don't want to violate that trust ever. And that is especially true of people who are transgender. If you find out somehow, and also keep in mind, there are HR policies governing these things. It is never appropriate, especially if you work in HR, to be talking about the private matters of your staff, right? So for transgender people, this can quickly become a safety issue. So it is never okay to talk about a person being trans if they have not given you permission to talk about that. And then practicing allyship in the office looks like if somebody you work with says something that you think is homophobic or transphobic or otherwise offensive, say something. Let them know you don't agree. And that doesn't have to be a hostile takedown, right? It doesn't have to be a, hey, what's wrong with you? You can't talk like that. I often find that the most effective thing to say is, I don't agree. I don't think that way, right? And modeling that, just modeling it and saying, I just really don't agree with you. I don't think there's anything wrong with being transgender. I think it's just, it's a normal part of some people's identity development. And I'm just going to continue treating my transgender clients with respect. I think that's important. And then just leave it, right? It doesn't have to become a super contentious thing, but sometimes it's really important to just make sure that person knows that you don't agree. And then if you're a manager, and especially if you are supervising LGBTQ staff, it's really important to believe your staff when they tell you that people are making them feel uncomfortable because of their sexual orientation or gender identity. People don't make that stuff up. If you're uncomfortable, there's a reason for it. And especially people in positions like human resources need to really be advocates and allies for LGBTQ staff. And there's some fantastic resources out there for HR professionals for creating safe workplaces for LGBTQ people. Next slide. So a little bit about Q Card Project. So the foundational belief of Q Card Project is that all queer and trans young people deserve quality, sensitive healthcare that meets their needs, recognizes their agency, and empowers them to be active participants in their health. So next slide. So we know that a lot of clinicians get trainings on how to take care of LGBTQ people, but that doesn't trickle down to patients, right? And so for a lot of us, we don't know a lot, especially young people, why we should talk about this. Is this important? What should we say? When should we bring it up? Is it even important, right? And so the Q Card is a communication tool that LGBTQ young people can use to start or continue a conversation about their sexual orientation and gender identity in a healthcare or social services setting. So as you can see in this sort of image of the Q Card, it folds into 3 panels. It's the size of a business card, so it'll fit in your pocket or in your wallet. You can write the name you want to be called. You can write your gender pronouns, and then you can fill in your sexual orientation, your gender identity. And then on the bottom, that bottom panel is actually a tear off. So on one side, it says, most LGBTQ youth are healthy and well-adjusted. As a result of cultural homophobia and stigma, some youth struggle with, and then it lists some of the disparities that we talked about a little bit earlier. And on the other side, it says healthcare providers can be important allies for LGBTQ youth by doing the following. And there's just a couple sort of quick and easy, talk about privacy, post affirming signs, avoid assumptions, some of these easy things that folks can do to make LGBTQ young people particularly feel safer and more welcome and more respected in those spaces. And so we printed the first round of these cards. There were 35,000 of them we printed in the spring of 2014. We're now at almost 200,000 of them distributed to 36 states and 4 countries. And so, you know, I certainly did not expect it to be this big, but we've clearly struck a nerve here. And there's really a demand for tools that patients and clients themselves can use to initiate these conversations if the people they're working with aren't starting those conversations themselves. So next slide. So how do you use a cue card? So like I said, these are now all over the country, and they go to places like clinics, drop-in centers, nonprofits, high schools, colleges, libraries, social service agencies. And the idea is that a young person might find one out in the world or find one at the front desk of a clinic, for example, fill it out with their information, or we recognize that not everybody will feel safe carrying one around with all of that information filled in. So some young people report that they just like to have it to sort of guide the conversation, but they don't want to fill it out, and that's totally fine. But then you bring that filled out card or just the blank one as a conversation starter to your next appointment, and you hand it over to the clinician or the social service provider to start a conversation, right? These are the things that you should know about me to help you take better care of me, right? And I think that part of what's so important about this is helping especially LGBTQ young people understand that having an ally and an advocate in a healthcare or social service setting can be really important to their health. It is actually essential that they talk about these things so that they can get better care. And I think for a lot of us, it's sort of, why would I talk about this with my doctor? Why is this important? But in order for us to stay healthy, it's really important that the people that are helping us stay healthy know about these important aspects of our lives. So next slide. So I always like to finish up my slides with a couple of cases, and I think Nika's monitoring the chat, so if you have thoughts about this, I'd love for you to type them into the chat box and share some of your ideas. So the first case here is about you're at the office and you overhear a couple of your colleagues discussing a client named Kaden who was in for a visit that morning. Your colleagues are using she, her pronouns to talk about Kaden, but you're pretty sure that Kaden uses he, him. So what do you say? How do you approach your colleagues? And the reason that this case is so important is because we have to be accountable to clients even when they're not in the room. It is not enough to just get it right when you're in front of the person. You have to honor and respect their identity all the time, right? So that's a really important piece of allyship. So if you want to just type a note into the chat box and sort of, what do you think you would do in a situation like this? What do you think you would say? Give you a minute or so to weigh in.
And if you want to chat them to admin as well, they'll be private, I can read them out too.
Yes, it's important to walk the walk every time. Yeah. It's
someone asked, is it appropriate to ask if they have asked the patient what pronouns they use?
Yes, that is an excellent point. And it's one of the ones that it's important to note here that it doesn't actually say here that Kaden uses he, him. It says you believe. So that's a really, yes. And this one that just came in, I overheard you talking, I believe Kaden goes by he, right? And saying, did you ask Kaden for pronouns? Last time I talked to Kaden, he said he used he, him, right? Checking in. I would clarify with my colleagues about whom they are talking about and if they know the pronouns the individual wants to use. Yes, excellent, absolutely. Does my colleague have any knowledge of how to ask about pronouns? Yeah, excellent point. It's possible that this person doesn't know, has never had this conversation, right? So I think approaching from a place of, are you sure, right? Checking yourself on that too, because people change their pronouns. So checking in and saying, hey, I overheard you talking. I love that example. I believe Kaden goes by he, and they might say, oh yeah, we were using he, him pronouns. Then today we were asked to use she, her. And you say, oh, good to know. I'll try to remember that too. And then I think the point about, does my colleague know how to ask this question is a really good point too, right? And again, I think, some people's instinct is to come at this in a more sort of aggressive, confrontational, like, you got it wrong, but you might also be wrong, right? So having the self-reflection to say, I think that Caden uses he, him. I want to check on this. Maybe I'm wrong, right? And then someone said, I find if I do not know the pronouns of a client, I will use their name of choice or calling them the individual. Yeah, if you don't know someone's pronouns and you don't get a chance to ask because they're not in the room, using their name is also a safe bet, right? So if you're talking about Caden and don't want to use pronouns, you can say, oh, Caden was in this morning and we were talking about this and Caden expressed this concern, right? That's a great point as well. Or referring to them as the individual. Some people say that, I don't know if anybody here has experience with clients or colleagues or friends that use they, them pronouns, but some people will tell you if you don't know someone's pronouns, it's okay to use they, them until you've figured it out. And I know that for some people that feels difficult because it feels sort of, some people say it's ungrammatical, but the truth is, you know, if you host a dinner party and someone leaves an umbrella behind, the next morning you don't say, oh, someone left his or her umbrella, right? You say somebody left their umbrella. We actually do have grammatical constructs for these things. It's just we're asking you to sort of flex that muscle in a new way. And that can sometimes be hard for people. But again, it's really important to try. So if you don't know a person's pronoun, you can use their name, or you can try using they, them until you're given correction and told, oh, actually this person uses a different pronoun. Yes, and then someone says, I have had a few people I know explain the use of they, them. It's really important. Yeah. And again, you know, people may change their pronouns over time. So it's important to keep checking in and not assume that just because a year ago someone used he, him, they're still using it, right? These things evolve over time. And it's just up to us to try and catch up, right? By being in social services and healthcare, we have committed to a lifetime of learning, because the world is always changing and recommendations are always changing, right? And we have to try and keep up, and this is no different. So thank you all for your thoughts on this case. We have another case, if Nika, you wanna move on to number 2. So number 2 is about a 17-year-old client that tells you he's being bullied at school. You have not previously discussed any LGBTQ topics, but you notice he has a rainbow pin on his backpack. So what questions might you ask? And in terms of where you are, do you know of any local organizations or resources that you could recommend? So again, let us know what you think in the chat box. I would start with a general question about what kind of bullying occurred and how come they were bullying them. I don't want to assume it was about gender or sexual orientation. That's a really good point, really important point. Just because this person might be LGBTQ, does not mean that that's the source of the bullying. Absolutely, it's a great point. Any other thoughts on how you might approach this? Yep, you could ask what kids are bullying them about. You should never assume it's LGBTQ related. And then it says, we have local resources here that can help. It's important to make sure they know that you are a safe place where they can talk about these issues. Yes, that's a huge point. Making sure that they know that you can be a supportive adult and that you're a person who can advocate for them. Absolutely. Yeah, and I think in asking about, you know, what kinds of things you're being bullied about, it's also really important to not make the person feel like they have to, you know, they may be bullied about something about which they're really self-conscious, right? Because kids can be cruel. We were all in middle and high school once. And, you know, if they're being bullied about their weight, that might have nothing to do with their LGBTQ status. If they, have an intellectual disability, right? Or if they're neurodivergent, they're on the autism spectrum, right? They might be bullied about something, like you said, that's not LGBTQ related. And it's also really important to know that there are a lot of young people who are being bullied for their perceived membership in the LGBTQ plus community, right? The assumption that they're gay, even if they are not, right? And so this young person might have a rainbow sticker or a pin on their bag because one of their parents is LGBTQ, or because they have an LGBTQ sibling and they're not LGBTQ at all. They want to be an ally, so they're wearing that pin, but they're being bullied for something else. Yes. So finding out, and not just asking flat out, like, why do you think they're picking on you? Because that might make the person feel like you're accusing them of doing something wrong, but sort of saying like, I'm so sorry to hear that this is happening to you. What's happening? What kinds of things are people saying or doing? And how can I support you in this? Yes. And then referencing those local resources, right? And then the other thing is the internet has given people incredible tools to connect with other LGBTQ, especially young people, and especially young people who are in more isolated communities where there's not like a brick and mortar community center where they can go. Finding community online certainly has its pros and cons, but for a lot of LGBTQ young people, it can be a real place of connection and refuge. Someone says, saying it in a reflective, empathetic way is very important. Absolutely. And again, this is a great place to use your, I'm so glad I told you that, right? So if in the process of this conversation, the person says, well, this 17-year-old young person says, well, I asked a boy out at school and he told everybody and now I'm being picked on, right? I'm so glad you told me that. Thank you for sharing. And I'm so sorry that this thing happened to you. How can I support you? Or, have you told anyone else about what's happening, right? Because it's also important to get a sense of whether this young person has support at home, right? Have you told anyone else? Do you have parents or siblings that you've been able to talk to about this? Because for some young people who are LGBTQ young people specifically, who are experiencing bullying because of their LGBTQ plus status, they're not out at home because that doesn't feel safe. And so the fact that they're now being bullied for the exact same thing that they can't talk about at home can just amplify that stress. So having a sense of what other supports this young person has can also be really important. Any other thoughts on what you might say to this young person? Or if you have specific examples of resources that or you are familiar with, feel free to put those in the chat as well so that other people can get a sense of, oh, hey, I didn't know that organization existed, or, oh, I didn't know that place had a reputation for working with LGBTQ folks. Sometimes that resource sharing is a really important piece as well. So I'll give folks a second to add any last thoughts, and then we'll move on to a sort of general Q&A. Within the comic book geek culture, there are many comic book stores that are becoming a safe place for LGBTQ. Yes, it's an excellent point. And one of the things that I've learned through this work is that libraries are an incredible place. And especially if your library system has teen librarians are tremendous advocates and allies for LGBTQ young people. Because if you think about it, a librarian's job is to help you find information, right? And so across the country, librarians are shepherding LGBTQ young people into incredible knowledge by helping them find resources. So comic book culture, great example, and one that a lot of people wouldn't think about, right? But there are tons of LGBTQ folks that love comic books, partly because so many of the stories in comic books, and particularly comic books about heroes and superheroes, right, are about people who had something they had to hide. People who felt alone because there was something special about them that they couldn't tell other people, right? They have to hide their identity. And that really resonates with a lot of LGBTQ people, especially LGBTQ young people, of like, there's something about me that I can't tell other people. It's like I have two identities and two lives. I have to be one person in public, and then in secret, I'm allowed to be my full self. Yeah. All right. So if anybody has general questions, feel free to add those into the chat box as well.
You can also send them to the admin account if you want it to be anonymous, and I can read them out. And please stick around until after questions for some announcements. I have a question from the chat asking, do you have advice for working with leadership that is hesitant to make some of these changes?
Yeah, that's a great question. It's a really great question. And I get questions like this a lot. And I get the question like, well, we don't have any LGBTQ clients, so why should we worry about this, right? I think that in terms of working with your organizational leadership, there are two important things. One of them is you probably have LGBTQ people on staff, right? And those folks deserve to feel like they work for an organization that cares about their safety and well-being. That's one approach. And then the other one is LGBTQ people in the state of Washington have certain protections. And as an organization, it's really important for you to live up to those things, because you don't want to put yourself in a situation where you have an organization that is now seen as hostile to the LGBTQ community, because we talk to each other, right? We have like a secret phone chain, and we will put you on blast. And this happens all the time in our community, where if I go to try to get services from a place and I feel disrespected, I will tell all of my friends, don't go there, right? And nobody wants to feel like, you as an organization, especially if you work there, you want to be able to be a person that is safe and welcoming. But now you have an organization that nobody in the LGBTQ community wants to come to because they think you're homophobic, right? So working with your organizational leadership to understand that, it's not that we're trying to make ourselves like the go-to LGBTQ service or resource. We just want to create an environment that's welcoming for everybody. And part of that is making sure that LGBTQ staff and LGBTQ clients feel like they will get a basic level of respect when they come through the doors. So I hope that some of that's helpful. I do think that it's really important. I think that sometimes sort of hitting that staff angle and saying like, we have LGBTQ employees who don't feel comfortable and safe here. And as an HR policy, like that's not a great look. And so we have to do better for our staff so that we can do better for our clients. But at the most basic level, it's, if you are a social service agency, you have a responsibility to offer excellent care to everyone who comes through the door. And that doesn't mean that everybody needs to be a perfect expert and get it exactly right every single time, but it's reasonable to expect that people will have a base level of understanding and respect. And some people will do better than others, right? And within the staff, you might over time develop a sense of like, oh, these are the 3 people that are like really knowledgeable and really good at this. And here are the folks that like maybe still have some more learning to do. And then as staff, supporting each other too. I think, I've totally worked in larger organizations that didn't have a super supportive culture, but we had a group of LGBTQ staff who got together. We would have like a lunchtime conference call. We were at multiple sites. We would have a lunchtime conference call like once a month and check in and say, hey, how's it going at your site? What's working well? What's not working as well? And sometimes what we'd find is, man, the clinic over there has figured out something really cool with our medical record. I'm going to see if we can do that here too. So some of that sharing, and I think the ACH can be a helpful place for that collaboration as well, in terms of thinking about what are different partners doing and what could I try. So if you've done something in your organization that's worked really well, this might be a great opportunity to share that information with other organizations that are struggling to figure this out.
All right, yeah. I have another question that hopefully we can answer quick so we can get to these announcements.
Yeah.
But can you talk about gender identity and pronouns that may not quote unquote match. For example, a cisgender person who may use like they, them pronouns.
Yeah, that's a great question. And the shortest possible answer is you got to do the best you can, because identity is complicated. And for a lot of people, identity changes over time and their pronouns may change over time. And I think what's really hard for us is that we have all been programmed to think that by looking at a person, I can tell what pronoun they use. And the more effectively we can break down that idea, the easier it becomes to use pronouns for people that seem like they're discordant, right? So the person who looks to you, like I have a friend who identifies as a non-binary femme, right? So non-binary fits under the transgender umbrella, but this person was assigned female at birth, looks to be very feminine to the world, and uses they, them pronouns, right? So the more that you can sort of break down this idea that like man, him, woman, her, right? The more we can try to be thoughtful and sort of separate those things out, the easier it becomes. And again, sometimes it's hard, sometimes you make mistakes. That's okay. The key is to make sure you ask the question, what pronouns would you like me to use when I refer to you? Or would you just prefer I use your name? Right? But I think it takes a little bit of work because we've all been programmed in a really specific way, and we have to be really thoughtful and keep checking ourselves. And we're all going to make mistakes from time to time. This isn't about being perfect. It's about making an effort. And the thing that I always like to remind people is sometimes it's uncomfortable to try to remember to use people's pronouns, but compare your few seconds of discomfort while you like trip over it in your head to the discomfort of a person that operates in the world as transgender, right? And by just taking those few extra seconds and trying to get it right, you can make a world of difference for a person who's probably constantly getting misgendered or constantly dealing with people using the wrong pronouns. So just checking yourself, taking a few extra seconds can really go a long way in building a relationship with a client. So thank you for that question. And then I do just want to note that somebody commented in here about our agency does not work with youth, but this knowledge applies to what we do with adults. And I think a lot of that's true. So although, I mostly focus my work with LGBTQ young people, a lot of this is applicable for LGBTQ adults as well. So thank you for pointing that out. And it's really, I know that NICA has some announcements. I just want to thank all of you. It was really a pleasure being with you today. And I thank you for all of your fantastic insights in the Q&A.
Yeah, thank you so much, Jinya. This was really great. And I'm so excited that we get announced that we're going to be doing some trainings with Jinya. So we're hoping to bring Jinya to all 5 counties to do some in-person trainings. So if that's something you're interested in, your staff attending and learning more about working with LGBTQ populations, please send me an email. My email is on the screen, micah@northsoundach.org, or you can give me a phone call at that number there, 360-543-8856. So we want to collect who wants to attend those so we can start getting those plans for the fall, and we're really excited to be working with Jinya more. As a reminder, next week is our partner retreat at Bellingham Technical College on August 7th and 8th, so we're really excited to see you there, and there will be no webinar. We will be back on August 14th with a webinar on the 6 building blocks model. And then we're trying to work on our continuous quality improvement here. So we are starting evaluations of all of these webinars. It's really short, takes about 2 minutes. It's great for us to gather information. It's great for Jinya. So Hillary posted the link in the group chat. Please take a couple minutes to fill that out. We'd really appreciate it. And it's also an opportunity for you to give your contact information if you're interested in these trainings. So if you could take a couple minutes and fill that out, I'd really appreciate it. And thank you so much, Jinya. This was great. And everybody have a great day.
Thank you so much. It was totally my pleasure. And I look forward to meeting some of you in person.